Are there alternatives to the multiple sleep latency test, MSLT? Imagine trying to find out if someone is sleepy during the day without making them take a nap in a lab. That's what the multiple sleep latency test is for, but it's not the only way to look at sleepiness. If you're wondering about other options, especially for diagnosing sleep apnea or other sleep issues, stay tuned. The MSLT involves several short naps during the day in a controlled setting to see how quickly someone falls asleep and if they enter REM sleep. It's mainly used for narcolepsy and hypersomnia, not sleep apnea. For sleep apnea, doctors usually turn to different tests. One common alternative is the polysomnography or sleep study. It's an overnight test that tracks brain waves, eye movements, muscle activity, heart rate, breathing, and oxygen levels. It helps find out if breathing stops or becomes shallow during sleep, which is key for diagnosing sleep apnea. Sometimes this test is combined with a CPAP titration, where the machine settings are adjusted to keep the airway open. Another option is the home sleep apnea test. It's a simpler, at-home version of the sleep study. It measures breathing, oxygen levels, and heart rate but doesn't record brain activity or detailed sleep stages. It's useful for screening and diagnosing sleep apnea when symptoms are clear. The maintenance of wakefulness test is similar to the MSLT but measures how well someone can stay awake during the day. It's often used after sleep apnea treatment to see if the person can stay awake in situations where sleepiness could be dangerous, like driving. There's also a research-based method called the polographic score of sleepiness. It uses daytime recordings of sleep stages and latency to give a score of how sleepy someone is. This method has been studied in narcolepsy, hypersomnia, and sleep apnea patients. Lastly, pulse oximetry is a low-cost screening tool that checks oxygen saturation and heart rate during sleep. It's not a full diagnostic test but can indicate if further testing is needed. In summary, while the MSLT is great for narcolepsy and hypersomnia, other tests like polysomnography, home sleep apnea testing, and the maintenance of wakefulness test are used depending on what the doctor suspects. For sleep apnea, the main tests are overnight sleep studies and home testing. These options help doctors get a clear picture of what's happening during sleep and guide the right treatment.